On behalf of the International Association of Universities, the IAU, and the Open University of Catalonia, I have the honor to welcome you to participants, speakers, and moderator to this IAU SDG cluster webinar addressing mental health and well-being in the universities. I am the immediate past president of the IAU and for many years closely involved in the engagement of IAU in higher education for sustainable development. And I'm not sure that everyone knows about the IAU, so I make a short introduction of the organizations. So IAU is the Global Association of Higher Education Institutions. The organization was founded by UNESCO in 1950 and still is an official partner. And at that time, it was in response to the need of a common global voice to promote and enhance the unique role of higher educations for democracy and societal development. Today, IAU has more than 600 members all around the world, and I think that we can all agree to that a common global voice for higher education is more important than ever. So higher education for sustainable development has been a strategic priority since the 90s for IAU. And in 2018, the IAU cluster on higher education for sustainable development was inaugurated. And this cluster, it's a consortium of higher education institutions working in collaborations to develop existing and new exciting initiatives to actually achieve the sustainable development goals. Today's webinar is co-organized with Open University of Catalonia and the leader of the IAU cluster on SDG 3. And I would like to take the opportunity and thank the university for your strong engagement, the actions and achievements promoting and supporting higher education for sustainable development. This webinar is one of two events ahead of World Mental Health Day, which is celebrated on the 10th of October. The second session will be on Thursday in Spanish. And why we have this, it's these webinars follows discussions within the IAU HISD cluster on SDG 3. And that is revealing that there is an increasing urgent need for discussing mental health and concerns among staff and students in higher education institutions, and that is also an issue all around the world. For higher education institutions to fulfill their role in society, they must care about and provide conditions for mental health and well-being of our employees and our students. They are the key to provide new knowledge through research and through education competence to all sectors of society. So today we have with us distinguished speakers who will share their experience in the field. And to start the webinar, I would like to introduce today's moderator, Liv Raphael. She is the cluster lead at the Open University of Catalonia. And I also would like to introduce Marta, who will make the conclusion remarks, who is the director of the Open University's eHealth Center. So with this, I open up the webinar, and of course, the success of the webinar is also all of your contributions. So I leave the floor to you, Liv.
Thank you so much, Pam Fredman, for this great introduction. And thank you to the co-organizers, IAU and UOC eHealth Center, for really providing the special space for us to be able to share on this really important topic. I also want to welcome the speakers. Thank you so much for sharing your time and your expertise so generously with us today. And just maybe quickly introduce you. So we have Ellen Brackenreg, Executive Director, Equity, Diversity, Safety, and Wellbeing at the Western Sydney University. We have Steve Lee, Mental Health and Wellbeing Team Manager, also at Western Sydney University. We have Galuh Suryandari, the University of Gadjah, Mada, medical education and PhD candidate in Indonesia. And she will also be jumping in for Titi Savriti Prihadingish, who unfortunately was not able to join us today, but really wanted to. So thank you, Galuh. And last but not least, we have Joy Louise Gumikiriza-Onoria, who's lecturer, clinical psychologist, and PhD fellow college at Health Sciences in Makerere University, Uganda. So we have 5 different countries represented today, so that's fantastic. And so thank you so much, everybody. So we're going to start. We have a lot to get through in an hour, but I think it's going to be very interesting and very rich. In terms of just quick housekeeping, we will have time at the end for a Q&A session. So please feel free to share any questions you have in the Q&A function. You can also use the chat to just speak among yourselves. And if there are questions that we're not able to get to just because of the time constraint, then we will publish kind of a report in November, and we will definitely go through all the questions and make sure they're answered there if they're not answered in this forum. So welcome to everybody who's here watching us. We appreciate your participation, and I think we're just going to jump right in. So I'd like to hand it over to Western Sydney University. I believe Ellen Brackenreg will start. Thank you.
So we've just, hello everyone, it's lovely to be here today. We're just quickly going to, we've already introduced ourselves, and Steve, if you can just sort of move to what we're hoping to cover today just very quickly. I'm going to look after the contextual bit, and then Steve will move on to really what we do in terms of our strategy and the highlights of our supporting staff and supporting students. So to give you a little bit of context, Western Sydney University is a substantial part of Greater Sydney metropolitan area, home to 2.5 million people, which is about 35% of the Sydney's population, and is expected to grow to 3 million by 2036. So driving 2/3 of Sydney's population increase in the coming years. The region is characterised by a remarkable cultural diversity, with 35% of residents born overseas, representing over 170 countries and speaking more than 100 languages. 60% of new immigrants to Australia all settle in Western Sydney. Economically, Western Sydney ranks as Australia's third largest economy, led by healthcare, retail and construction. But faces certain socio-economic challenges. So, for example, there's a 7.2% unemployment rate and comparatively lower average salaries than other parts of Sydney. Western Sydney University was established in 1989 and plays a pivotal role in regional development, with an enrolment exceeding 50,000 students and a global alumni network of 200,000. It is internationally recognised. It ranks first in the Times Higher Education Impact Rankings for Sustainability and Social Justice, and is consistently ranked within the top 2% of universities worldwide, and furthermore 85% of our research output is rated at or above world standards. Western Sydney University differentiates itself with an emphasis on accessibility and inclusion. We have multiple campus locations, many alternative entry pathways. We actually have a student cohort that reflects our greater Western Sydney University community in terms of its diversity. And 65% of our students are first generation university attendees, which underscores our role in advancing social mobility. The university maintains strong industry connections, ensuring relevance of academic programs and providing students with real-world experience. Through our Western growth strategy, the university is helping shape the region's future. The other part of the contextual information is that we are currently operating in a very changing political landscape, with a growing emphasis on student wellbeing. The Australian Higher Education, firstly, the Universities Accord, initiated in 2023, represents a comprehensive review of the higher education sector, one that hasn't been undertaken for about 30 or 40 years. So it's really quite changing. It will change our sector. This accord addresses critical aspects, including accessibility, affordability, quality of education, and enhanced student support services. The Tertiary Education Quality and Standards Agency has intensified its focus on student wellbeing. That's really important. They're our quality standards agency. And recent changes include the implementation of new standards requiring universities to actively address student mental health and safety issues. Further, recent workplace health and safety legislation now recognises psychosocial hazards in educational settings. This is important because universities are now mandated to identify and manage risks such as excessive workloads for our staff, inadequate support for our staff and students, and potential harassment impacting our staff and students. And lastly, we have, along with every other Australian university, revised our student support, our support for students policy as a part of the university's Accord program process. And these updates align with the new regulations, emphasising proactive support measures, early intervention strategies, and the integration of wellbeing considerations into curriculum design and university culture. And those changes reflect a growing recognition of the importance of student wellbeing in higher education in Australia, driving universities to review and adapt their support strategies. And I'll just hand over to Steve.
Thank you, Ellen. So what does this look like for our people? What does it look like for us as people in a university? I think post-COVID, what we've noticed and what we recognised is that we've seen a rising cost of living in Australia, which has meant that many of our students and our staff have had to prioritise work and earning over studying and other things related to the university, which has resulted in many of our students and our people's well-being being influenced by juggling work-life balance. And we're seeing that exacerbated particularly during periods when students are asked to attend placement, where students are often managing full-time placement and full-time work. Our students are working more than what they had to previously, was also managing that kind of work-life balance as well. Other emerging themes and concerns that we've seen in this new post-COVID era have been an increased need for our services to respond to connection and belonging, or a need for our students to feel like they are connected and they belong in our system and to our university. And that was kind of exacerbated or highlighted by a reluctance for our people to return to campus post-COVID. Noticeable, like a social unease, where people were re-navigating kind of social norms and attending online classes, and our staff navigating hybrid work arrangements as well. We've also seen an emergence and a need to support particular cohorts of students who have been identified as more likely to be at risk of poor wellbeing outcomes. Noticeably, our international students our LGBTIQ+ students, who are members of our rainbow community, Aboriginal and Torres Strait Islander students, students with disabilities, as well as students from particular schools and cohorts of schools who have been identified at risk of poor wellbeing outcomes. So they are our graduate research school, our college, who are often our population of the younger students and some international students in there. Schools with a prevalence of students heading out on placements, so nursing, midwifery, paramedicine, social work, psychology, education. And our work in these spaces is aligned to our strategy, but it also focuses really on normalising our stress and normalising our human responses to stress. We work in universities as stressful environments, and promoting ways of coping and a culture of help-seeking behaviour, helping those people who need them provide or get the right support at the right time. Ellen, you want to talk about our strategy?
Yeah, just very quickly, Western Sydney University's Wellbeing and Mental Health Strategy 2022 to 2026 represents an important evolution in the university's approach to supporting the mental health and wellbeing of our community. The strategy is the third revised version of the original Mental Health and Wellbeing Strategy launched in 2011, the first strategy of its kind in an Australian university. From the very first strategy, we have taken a holistic and university-wide approach to the mental health and wellbeing of our staff and our students. The underlying principle that we have used is what affects our students affects our staff, and what affects our staff affects our students. The current strategy builds on previous strategies and places increased emphasis upon our people, putting well-being at the forefront, and hence we've changed the name of the strategy from the Mental Health and Wellbeing Strategy to the Wellbeing and Mental Health Strategy. We position ourselves as a health promoting university that aims to create a safe, supportive and healthy environment where all of our community members can flourish. And our strategy is grounded in a normalising philosophy of health and wellbeing using a dynamic and strengths-based approach. And I'll hand over to Steve to talk about the pillars and some of the key objectives.
Thanks, Ellen. Our strategy identifies systemic opportunities for staff and students to co-create plans which recognises our resilience as a community, promotes safety and well-being, prevents illness, so it's our promotion, prevention, supporting those through early intervention strategies, and systemic response or responding appropriately to distress. What we really want to do is embed mental health and wellbeing responses across our entire university community, which we realise that we need strong leadership and appropriate partnerships, both within our university system and in the wider community. We need a long-term commitment to continuing innovation, and we need to continually evolve our responses to meet the emerging students and staff needs that we have as a community. And we've taken as much time as we possibly can there, Liv. So we'll end there, and we'll highlight some key pieces of work later on in our webinar.
Fantastic. Thank you so much for this very complete presentation, both on the context and on your strategy. I think what I heard was there was in the context a lot about supporting students and staff and managing work-life balance, which I imagine is common to our universities, connection and belonging with this new hybrid setup that we all have since COVID, supporting those most at risk, and really focusing on those in more situation of vulnerability. A strategic framework, which really I think is really helpful to put it all together in terms of the interventions that you may then be implementing. And the embeddedness, how do we then embed it in the university, which I imagine is a journey. So thank you very much. And I will now hand it over to Galuh Suryandari, Indonesia, University Gadjah Mada.
Okay, before I start my presentation, let me introduce myself. My name is Galuh Suryandari. I am a PhD student of Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, or we abbreviation of FKKMK UGM, Gadjah Mada University. I will present it about the mental health in Indonesia generally and Gadjah Mada University, particularly the perspective, research, and story about the successful and the challenges. Okay. Mental health in Indonesia has been a major issue since 10 years ago. In the fact of that government, through its highest leader, the president, drafted and passed a specific law on mental health, law number 18 of 2014 of the government's seriousness about the guaranteeing the right of its citizens to obtain optimal mental health. So the government is very very curious to maintain the mental health care. Okay, from the law that has been drafted and passed, government with the Ministry of Health translated into a guidebook for mental health services at the first level health facilities. It is expected to be a guide to comprehensive healthcare program for community mental health that can be optimized in primary care. So the guideline is for first care, primary care to get the community care mental health. However, recently there is a problems. Incidents of mental health problems has actually emerged from the educational process of the resident doctors. So the resident doctor is the postgraduate students of medical students who are later expected to be able to solve public health problems. But from 12,121 students was taken by the Ministry of Health from 28 major teaching hospitals in Indonesia in March 2024. The incident of mental health problem like depression in a various level come into suicide case, one suicide case. So it is a very emerged case for us. Okay, to obtain the problem, mental health in Gadjah Mada University as an institution that is fully committed to supporting the government in ensuring the mental health of its students, has tried to make some comprehensive effort. The effort starts from promotive, preventive, curative, and rehabilitative program. The regulations are made by the rector as the highest leader, then implemented by the health promoting university unit through its website. So there is any website that can be maintained about the mental health area and can be accessed by all students. And development of guidebook in the main hope of operationalizing the work program for preventing and overcoming mental health problems. This is described in detail with several flow chart about the curative and rehabilitative problem for students, teacher, and non-teaching staff. So there is not only the students, but the academic, civitas academic. So there is a student, teacher, and non-teaching staff. Until the social rehabilitation process if there is a mental health problem to the community. Okay, and one form of support for the mental health in our university is about the ease of licensing to conduct research in the realm of mental health. This is evident in my current dissertation research related to the following title: The Healthy Soul Toward Religiousness Learning versus Burnout in Medical Student. The method is mixed method, explanatory sequential with two groups intervention control. With intervention is about the Islamic religiousness learning, and the novelty is IRHS 24 questionnaire, and about the total sample of 1,670 sample, and it will be processing in the data and hopefully will be compliant in 2025. Okay, and this is about our success story, Liv. In our university, there are guideline for Indonesia suicide first aid. So UGM proposed some book for a guideline about the suicide first aid. So about the various case about suicide ideation until the suicide case, we support about the guideline for promoting and mental health to provide prevent suicide. I'm sorry. And about the chat box, we have launching the chat box program for mental consultation as a privacy as they want. Yeah. And about the leaflet hotline leaflet that patch in every general facilities. So if the student or the teacher or non-teaching staff have some mental health case or physical violence or sexual violence or bullying, they can report in the hotline. Okay. And the challenging of university mental health, I think it's the same in a globally problem. Yes, it's about the role of Gadjah in changing communication pattern. So it can be weakening of intensive face-to-face communication, and compound with the heavy learning activities, assignment and exam that's very full, resulting in a lack of direct interaction that affect the ability to tell stories and share information intensely, and actually has a great potential for mental well-being problems. So this continues to be a challenge for us to improve and innovate it further. That's all, Liv. Thank you.
Thank you so much, Galuh.
Okay.
It's very, very complete as well, and very, I think, very informative and a lot of learning for everybody. So I think what I heard from you is first that there's a strong commitment in Indonesia coming from the government, but all kind of stakeholders towards mental health as and I liked your focus on community mental health care. So I think that's an area that many countries are focusing on. Also saying that, you know, it's not just students, it's also postgraduates, it's also the teaching staff, the non-teaching administrative staff that we need to focus on. The link between value, spirituality, and resilience, that's really interesting. And I look forward to seeing the results of your research. And then the success and the challenges we'll talk a little bit more about in the next section. But thank you very much for presenting it. And I will just hand it over to Joy Louise. Gumikiriza-Onoria, Makerere University, Uganda.
Thank you very much. Good morning to where it is morning, good afternoon where it is afternoon, and good evening. It's nice to have this kind of diversity since we're talking about mental health challenges. So I'm here to talk about mental health challenges in universities, and I'm just going to focus a little bit on what do we go through as students? What are the mental health challenges like for students? I'm not going to generalize to Makerere University because I believe this cuts across all the different other areas, just like we've been hearing. So I'm also going to look at what are some of the factors and what are the supporting systems. So amongst us here, we have teaching staff or professors. We also have students. So what is our role and how does this play out for all of us? So in terms of our introduction, a university per se fosters mental health issues because of the different academic and social pressures that are experienced by the students, as well as the member of staff themselves. So these academic and social stressors contribute to increased or heightened mental health challenges faced by different people. And the fact that a university for a student is a place where we are transitioning in a different life stages. You're coming from a place where you are a young adult, yes, but here we are training you to become a career individual. So there's a lot of transition, there's a lot of uncertainty. So this presents a lot of vulnerabilities that are going to affect and impact your mental health. So you'll find that as a student, also as a staff, there are quite a number of unique mental health challenges that we all do experience. So some of the most prevalent mental health issues that have been seen globally are anxiety, depression, but we don't forget substance abuse disorders as well. And these are quite common and they're reported by many of the students. And majority of these are attributed to factors like the academic load, the financial stress, the social pressures that are experienced, and the isolation that is seen when someone joins university, because you're moving from one place to another and you're finding yourself in an environment that is totally new, people that are new, rules and regulations that possibly are not there or are not really new. So that transitioning also affects the way we perceive the mental health issues and how our mental health is affected. And of course, we do not forget the post-COVID. Post-COVID, we have seen increases in social anxiety and adjustment disorders and many other disorders that have come out. Suicide rates, increased depression rates. We have all seen these as a result of the COVID. And this has also been alluded to by the previous speakers. So in staff members, the professors or the lecturers, so I'm going to be alternately using academic staff, because where I come from, the different hierarchies. So we have assistant lecturers, senior lecturers, associate professors, then professors, but all of us are teaching staff. So we too experience increased workloads, burnout, job insecurities, and many times a perceived lack of support or an actual lack of support. Now, this also coupled with role ambiguities and emotional labors contributes to the increased rates of anxiety, depression, exhaustion, distress that we experience as members of staff who are conducting the classes for the students. But we have shared challenges. As the students as well as the staff members, we have shared challenges, and these include the academic pressure. There's intense academic pressure on the students who have to prove themselves, but also the staff. We have a lot of professional expectations, and these lead to chronic stress. We also have social isolation. Many times your office becomes kind of your home. You isolate yourself, you sit in that office and you do the rest of the work. You're just interacting with the computer, and maybe some of the students who come in, but also this happens to the students. Like I mentioned earlier, they're coming from a place, possibly they've had to travel miles and miles away to get to the particular university. Many of them might not even have a relative or a friend in that particular university. So there is that sense of loneliness, the sense of isolation, which is also going to increase the mental distress. We do not forget the financial stresses. These affect staff members and students as well. So the disparity in the tuition, the salaries that we see, the differences in salary, rising tuition costs, these also are they're affecting the student and staff mental health. We don't forget to talk about the technological overload. Back in the day, yeah, the technology wasn't there, but it wasn't as much as we see right now. Right now, we have 24/7 availability through emails. You're attending webinars like we're doing right now. You're attending classes. You're doing different meetings, you're on social media. So all this bombardment from the technology is also increasing the stress levels of many staff members as well as students. So then what is the role of the universities in trying to mitigate these challenges? One, universities need counseling services. I've seen the previous speakers have talked about some of the systems that they have in place. If this could be seen across the board in all universities, have counseling services. In Makerere, we have some online, on campus, and some remote counseling services for students mainly, but also for staff. This doesn't go very far back, but it is there, it's in place. So if we can have these services everywhere and have people go for them, this will go a long way in trying to improve the mental health. So the universities also need to put together mental health awareness programs like what we're doing right now, have workshops, have seminars, have webinars, anything, events that will be able to promote mental health and awareness. Of course, we need an academic flexibility as the university. We need to look at how can we have some extensions, can we have some reduced workload, of course, not compromising the quality that we are putting out, but then can we also have inclusive policies? Because when we do these as universities, then we are able to foster a proper mental health support network for our students as well. But we also need peer support services in place where we have student-driven support groups that are going to encourage a community and understanding of the mental health issues. A problem shared is a problem half solved. So I want to look at the critical role of the teaching staff. As a teaching staff, you are the first point of contact with the student. So we have a role in supporting the mental health of these students. We often interact with them daily. So if there's a possibility of having the staff members, that is the professors, lecturers, and name it, trained to identify the early signs of mental health issues. For example, absenteeism. You have a student who has always been attending on time and you no longer see them. That is a red flag. Be able to look at the academic performance of students and see the notable declines. That is also a red flag. We need to also be able to identify the changes in behavior. All these are crucial if we incorporate this in the training of our professors. We also need to see that we as the staff members build a trust and build a trusting and create an environment that is non-judgmental, an environment that encourages the students to reach out to us and seek help, not an environment where, you know, the power lines are drawn and students don't feel comfortable enough to reach out and possibly address some of the pertinent mental issues, mental health challenges they are experiencing. But, you know, this comes with challenges. There are numerous gaps that have been alluded to in quite a number of the literature. And stigma is one of them. When someone knows you're going to see a shrink, immediately they coil in, they fear. There's that perceived stigma. But at times it's also actual stigma. So this stigma will prevent the students and staff from seeking help. We also have insufficient resources. Yes, many universities are putting something in place, but still, this goes a long way in trying to reach out to every student and every staff member. Of course, we don't forget the lack of training. We don't have so much mental health training in our different careers. So if we lack this training, the professors and staff members don't have the adequate training in being aware of the mental health issues, this becomes a challenge. It impedes the ability for you to even identify a student who is, or a staff member, a colleague who could be grappling with mental health issues. So then what are the solutions? One, we need to advocate for increasing in funding, expand these services so that they can meet both the students and staff. We need to implement mental health training as well for the professors, I mean the teaching staff. We need to equip the academic staff with skills to recognize and be able to refer mental health issues as well. We also need to look at how do we reduce and balance the academic pressures, and then how do we promote the peer and staff support networks? Because there needs to be an environment of openness and communication. We need to have these structured programs that are able to foster this kind of environment where people can freely express their mental health issues and also have redress towards them. So then what is there to learn today? Some of the best practices. The previous speakers have spoken about their best practices, what they're doing in their universities. So if we can pick from that and integrate and also have an integration of our mental health into the different curriculums, that would be very good. If we can have effective peer support networks to reduce stigma, that would also be very good. And then we share the best practices with other institutions like we're doing right now. We learn from the different institutions and see that we have a united front doing something similar, but all of us vying for improved mental health outcomes for both the staff members as well as the students. And the way forward is what we have that we've seen works. Let's scale it up. We need to expand the research efforts on mental health, encourage students to undertake research that is mental health driven, have these published. Let us learn from this. Let us adapt to the emerging challenges, because this is a very rapidly changing environment. But also we shouldn't stop the innovation. Let's continue the innovations, particularly in the e-health tools that we have. So as I conclude, universities play a pivotal role in shaping the mental health and well-being of their communities. So when we train our professors, we also incorporate the mental health, a small mental health curriculum in all the university programs, then we're going to be able to create a healthier academic environment. So I call upon all of us to action. Let us prioritize mental health in our institutions. It's important for us to have research and policy development, but then it's also important to contribute to ongoing efforts so that we can improve the health support. Thank you very much for listening.
Thank you so much, Louise, for so many very important points, both on context. So I think what I heard from you was, the importance of taking into account the context. The context has changed, and I think that was echoed by several speakers. And so we need to now adapt to this changing hybrid context. I also really liked kind of the idea of thinking about peer networks, thinking about support from the professors, but also the training that needs to go behind that, right? Because as first contact, there's a great potential as being first contact, but at the same time, there does need to be training. So very interesting point as well. A lot more that I could comment on, but I'm aware of time. And I think now is kind of when we'll have the discussion about kind of the key learnings and maybe the challenges, but I would like to hand it over perhaps to Steve Lee, because so you can maybe discuss your success and challenges, and then we can have kind of a more open discussion. Steve, the floor is yours.
I'll be very quick, but this is a great segue from Joy's amazing presentation just into some of the work that we've been doing here at the university. And one of those is our peer support program, and our role as a mental health and wellbeing team in supporting that peer support program. The slogan that we've used and the way that we've navigated that and the success we've had is in supporting our staff to support our students or support our people. And so how that looks in this program, the QR codes there should link to the websites related to those things. So I won't spend time unpacking what they all are, but I will say that what we've done is provided support in those things through targeted workshops and training for our staff around identifying initially what is well-being and what is mental health. How do we go about recognizing and responding to students and staff, colleagues who are in distress or presenting in distress. And we've done that quite systemically across our board through consistent language and consistent presentations and styles of doing things. In this particular instance, it looks like monthly connections and monthly workshops with a bunch of students who are supporting our staff. We provide situational reviews and consultations. And we've also worked alongside these students to create the next piece of work there, which are wellbeing plans. What we've seen in our peer support programs and the support that we provided is that there's been an increased capacity of our staff to be able to respond to student presentations, but also a reduced referrals to our university counselling services in that regard as well. The wellbeing plans themselves serve two purposes. One of the purposes is for our students to be able to have a tool that they could use to reflect on their own wellbeing and to guide them through a series of questions that would enable to help them reflect on what's happening for them, what the impact of that could be on their university life, and what's happening as people and as students first. What works, so that strength-based practice there around reminding people that they are full of capability. They're amazing people. You don't get to university without having gone through some stuff in the first place. So reminding people of their strengths and their capabilities, and then an invitation to say, well, what else do you need? What else could we as a system do to support you? And the last little bit of success here that we're having, and I'm skimming over this really quickly because I'm happy to answer any questions later on, is our wellbeing framework, which we've designed to support our staff and engaging our people in wellbeing conversations and setting up a system of wellbeing responses across our multiple different cohorts in our university. I did want to come back to wellbeing plans and just quickly say that we're actually working on a pilot at the moment. We've digitized those wellbeing plans, and we are working with a school who are looking at adding those into curriculum. So students will be completing those wellbeing plans in class, supervised by a facilitator, and we just had ethics approval to conduct some research on the efficacy of that as well. So yeah, it's one of the successes that we're having as a university at the moment.
And probably to mention, Steve, that dependent on the outcomes in the pilot, we then hope to actually broaden that out to all schools within the university.
Fantastic. Thank you very much. Just to say also that the slides will be shared, because there is a lot of really interesting context that we unfortunately don't have, content that we unfortunately don't have time to go very deeply into, but they will be shared. And thank you so much for sharing that, the QR codes with more detail, because I think it's a very interesting pilot and program, and I think again that we can all learn from. So thank you. So thank you everybody for sharing the context, your successes, your challenges. I thought what would be helpful now is maybe just to have a conversation, maybe just focusing first on if we could kind of identify maybe each speaker a success that you, or a key learning perhaps that you may want to share with the audience from kind of all the experience you've had so far. What would it be? What would that key learning be?
Well, I'll start. For me, I think one of the key learnings is that we have to listen to the voice of the lived experience. So we have to co-create with our staff and our students any programs. We spend a lot of time talking to our staff and students and what will make a difference to them. And the other thing is we all have a tendency sometimes to set and forget. So we implement something and then we don't follow it up. And one of the key things, I think, as Steve has mentioned, is that consistency of communication. And we're not just doing it once, but we're doing it a number of times, and reviewing things and getting feedback and making things better, or if they're not working, we don't do them. So they're just a couple of things.
So I really like just listening, right? Listening, active listening, co-creation, consistency of communication, review, learning by doing, and then course correcting, when it's necessary. Louise, did you want to add to that?
Yeah, thank you very much. I just want to overemphasize what Ellen has just said. Active listening. Learn from what is on ground, not run away from it. Let us not be ostriches and think, things are okay. Let's be able to listen. Let's listen with everything we have, our eyes, our ears. Let's just be able to listen and learn and learn from each other, foster the environment, because, the times have changed. This is something that we need to really work on as soon as yesterday.
Yes. I told once we have two ears and one mouth for a reason, right? Listen twice as much as you talk. Does anyone want to add to that?
I think one of the points that I think I saw you put into the comments, Pam, was about leadership. And I just wanted to say that leadership is incredibly important. That we get our senior staff involved in this conversation and involved in the work and aware of what's happening. And it makes a real difference, I've got to say, to being able to move things forward. Sometimes the funding doesn't necessarily flow because of situations that universities find themselves in, but that leader at the top who is actually putting the message out there as well is so important. And again, the same message, which is wonderful. And we do have the benefit of having that at our university.
Great. Pam, did you want to intervene?
Yeah, may I give a comment to that? Because I think that the leadership is so important. And I also see that the leadership together within the national context, but also in the global context, could act to be a stronger voice to politicians, to funding agencies, to the funders, because the funding is crucial also for how to work with this. So I think that we all can encourage each other to see too that the leadership is taking the action also outside the universities to get the support needed for really getting well-being and taking care of the mental health issues in the universities.
An excellent point. I think we've talked a lot about what is needed and what the solutions could be, but the funding is kind of the key piece as well. Yeah. So so getting the voice out there and the leadership speaking, advocating for mental health, definitely and a really important point. Just as a segue to that, perhaps we could think about maybe what I don't know if it's challenges, but what are kind of the questions that we should be focusing on now, knowing where we are today? Are there any? Yeah, what kind of comes to mind in terms of challenges or questions?
One of the biggest challenges or questions that we grapple with, and Steve might like to talk to this or add to it, but we're constantly being asked, how do you know this is making a difference? So how do you measure impact of some of the things that we do, and that is a challenge sometimes in this sort of space. So I don't know if other members here have any insights into how we could do that more effectively. And it sort of goes back to Pam's point too about, we need to move, I guess, outside of our universities and work together to increase our voice. What's that saying? Together we are stronger. To increase our voice so that we are heard. But yes, I think from my perspective at least, measuring impact is sometimes difficult in this space.
And adding to that, I think that we have to see that what about all the stakeholders in societies? Because if they are supporting that higher education institutions and the education and the knowledge we are providing is crucial for what they foresee in the society. I think that is. I don't think that we are very good in signaling to the society what are we giving our students, what are we there for, and. We are discussing in many countries now the threats that we see among individuals. I mean, we can't stop it. We have all these media, the digital different medias with a lot of concerns. No one seems to be secure. And I think that we have a very important role to probably go back to campus and have these interactions physically, face to face, and see how could we foster another view on how we interact with each other for the future.
Great, thank you, Pam. I think yes, others have mentioned the context has changed. We're in a hybrid environment, but the face-to-face contact is quite important. No? So how do we have those conversations, and what does that balance need to be? So I think I'm just conscious of time, so I'm just going to have a quick. So thank you so much for all of you for your contributions. I'm just going to have a quick look at the Q&A to see if there's any. I think most of the questions, if I'm not wrong, have been answered through the chat. I think there's one perhaps that hasn't been answered, so I'll just answer it now. We have about 2 minutes left, so just very quickly, well-being. This question comes from Glenn Chatelier. Well-being and mental health among all stakeholders on campus needs to be carefully defined, given that learners who need to be nurtured intellectually and thus as much possibly insulated from the throes and ills of mental health intrusions. Has IAU UNESCO suggested a refined definition to mental health on university campuses? I don't know if that one can be answered now, or if not, we can also look into it for the report. Does anyone want to address that one? Or we could just maybe put it aside and address it in the report, if that's okay. And I think well, thank you all for your amazing interventions. It was, I think, for me, what this really kind of showed is that when we have these discussions, we realize that our challenges are shared and the solutions are also shared through these discussions. And there's a lot of learning to be had. And I think we will try to draw it out as much as we possibly can in the report as well. I'd like to hand it over to Marta Aymerich, the director of the Health Center, to just do the closing. And just, yeah, thank you all for being here, the speakers and all the participants. And we look forward to continuing the conversation. Marta Aymerich, can I hand it over to you?
Thank you again. Let me thank you all for participating in today's enlightening discussion, I would say, on mental health and well-being in universities. So as we conclude, just let me briefly some of key insights from our speakers. Steve Lee and Ellen Brackenreg from Western Sydney University emphasized the importance of their, I would say, 4-pillar framework: prevention, promotion, early intervention, and systemic response. And the Western Success Project demonstrated how peer-to-peer support systems, I think, can make a real difference in identifying and helping students facing challenges. On the other hand, Galuh Suryandari from Universitas Gadjah Mada shared a valuable perspective from Indonesia, highlighting how mental health is being prioritized really at the highest levels of institutions policy. And really their research on building resilience in education curricula offers, I think, promising pathways forward. And Louise Gumikiriza-Onoria from Makerere University provided real crucial insights into the role of professors as first points of contact and the importance of understanding underlying factors in mental health challenges within the academic community. So common themes that emerged today include, first, the shift toward preventive approaches and active listening alongside treatment. The significance, and second place, the significance of considering both individual and community contexts, as well as leadership. And as a third insight, the common theme, the ongoing challenge of scaling support to reach all who need it. So on behalf of the Open University of Catalonia and the International Association of Universities, I would like to extend our heartfelt thanks to our speakers and moderator for sharing their expertise and experiences. And for those interested in continuing this important conversation, we have another webinar scheduled for Thursday, October 3rd at 5 p.m. Central European Summer Time, featuring perspectives from UOC, from the Open University of Catalonia, from the Universitat Autónoma Metropolitana de Mexico, and Universitat de Caldas from Colombia. That will be in Spanish. So thank you all for your attention and participation. And as Pam Fredman, past president of IAU, forecasted at the beginning in her introduction, your contribution with your questions and comments made the webinar even greater, I think. So together we can work towards creating more supportive and mentally healthy university environments.